Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. Today, we talk about teeth and dental work and mercury. I have a wonderful friend by the name of Dr. Candida Castillo. She is in Rhode Island, and she is a dedicated biological dentist of 25 plus years of experience. Dr. Castillo certainly knows a thing or two about transforming patients' lives for the better. She loves being able to work closely with individuals on their dental health, their overall health, and the critical connection between mouth and body that influences both. Dr. Castillo achieved her dental doctorate at Boston University. Since then, she has achieved several fellowships due to her dedication and commitment to lifelong learning, including with the Academy of General Dentistry and International Dental Implant Association. She's completed the Certificate of Advanced Graduate Study postmaster's program at Boston University. She additionally has her biological certification through the International Academy of Biological Dentistry and Medicine and her SMART certification through the International Academy of Oral Medicine and Toxicology. To this day, she continues to pursue her education opportunities through prestigious organizations like the Dawson Academy and Spear Education. Outside of dentistry, Dr. Castillo enjoys traveling with her family and being active in her faith community. Welcome, Dr. Castillo.
Thank you. Thank you for having me. It's a pleasure to be here.
Great to have you. And hey, everybody, if you like this episode, please click the like button and subscribe. So let's dive in. How did you get into doing all of this?
Well, thanks for asking. That's a question that I have that I often get asked. And I dive into holistic dentistry by being a volunteer in a homeless shelter, which actually we were doing totally the opposite of what is holistic dentistry. At that point, I met Dr. Arthur, which was the only holistic dentistry in Rhode Island. And she started talking to me about holistic dentistry and what was to be more mercury free and using material that were not toxic or more non-toxic to the system. And I was very impressed by that. And I started doing research. At that point, I already owned my practice and I was not doing any type of mercury, but I was not a holistic dentistry. When I started diving into understanding what was this type of material that we were using, doing to our body, I could not stop learning more. And it has been a wonderful journey to me, to my patients, to my staff. And it's something that I really, really enjoy because the more that I learn, the more that I see the connection. Our mouth relates to our gut, to our lungs, to our brain, to every organ in our body. And one of the things that I usually say in the practice is that if you have a toothache, look where that tooth is, what's the connection with that organ? And you'll figure out that, okay, something is connecting. And we'll see that every single day. So it's been a wonderful journey.
That's awesome. That's really awesome. So it sounds like she really inspired you to look at dentistry differently and connecting the dots and finding the root cause of the problem.
Correct.
Yeah. So tell us more about how biological or holistic dentistry is different from conventional dentistry. Can you give us some ideas?
Absolutely. So when we talk about biological dentistry, we're talking about treating the body as a whole. You come to see me and I'm not going to only, concentrate on treating that pain that you have in the tooth, but let's see what is the rest of the body. One of the things that we use in dentistry is that we take in consideration your organs. What is the connection? And holistic dentistry, look into what material are we going to use for you? Mm-hmm. What is the compatibility? What is any allergies? What is your immune system? Let's take into consideration, how long has the problem been there? Has the problem got worse? And how we're going to treat it? So when we talk about biological dentistry, we look about whole, treating the connection or how one thing affects the other. How's your mouth relate to your body? How does your body also come back and relate to any problem that is happening in your mouth, in your gums? So biological dentistry have evolved to be this inclusive of all the things that contribute to oral health and contribute to body health. So connecting the dots is resulting to a better longevity, a better immune system. So all those little things have come together to give you what is biological dentistry.
Mm-hmm. Yeah, that's great. I loved your explanation of that and the differences. So, one thing that I find and why I refer people to biological dentists is that when I do an exam of the mouth, I see a lot of cavities, well, not a lot of cavities, but a lot of fillings in these cavities, right? And looking at the health of the gums, the health of the teeth, and sometimes rarely I do see the occasion where I see two metals up against each other, right? And that to me is like an explosion waiting to happen because of what that can create. And I wonder if you could talk more about that and why that's a huge issue.
I'm glad that you mentioned that, because when I was in dental school, one of the things that we learned in chemistry, going through dental school, and how everything is a chemical reaction in our body, is that metal can produce galvanism, which is like two different metals. You think about battery coming together, negative and positive.
Mm-hmm.
And when you do that, you produce a reaction. Well, guess what happened in our mouth? The same thing. You get gold, you get mercury, you get, silver, you have different type of metal, and that pretty much is what produces that galvanism.
Mm-hmm.
And that affects our body in a way that sometimes is simple to understand, in a way that if you have energy going a different direction, you don't get healing. Our body pretty much healed by energy.
Mm-hmm.
And if you have different metal, especially someone that might be allergic to metal, and you just have that person with a mouth full of mercury, we have a big problem. That person is going to be sick, and it's going to be difficult to find the problem unless you address these issues. Right. So we're going back to biological dentistry. That is one of the things that we don't use. We mercury free for the same reason. Mercury effect is a neurological toxin. Mm-hmm. So the reaction that you get from having mercury in your mouth could be very silent for some people, but it could be detrimental for other people. And we see that every day. We see someone that comes and they have fatigue, and they have gut issues, they have, foggy brain, they have a lot of problems that people come and say, oh, no, you're fine. When they do the testing, you're fine. Fine to what? Fine to someone that is dying or someone that is completely healthy? Right. But where are you there? So when you're looking about galvanism, huge issue that we have, because we had to be testing to see how is this contributing to your overall health. So very, very important. And that's why, again, going back to biological dentistry, we try to be mercury free, or try not to use it, or don't use it at all when it comes to mercury, but metal free. You're trying to be more holistic in what you provide to the body, so the body can use the power to heal itself. Right. Try to use less chemical. So those are things that you try to provide to the patient so you can actually heal.
Right. Right. So when you take the these fillings out, the mercury fillings out, and let's say someone has gold in their tooth and it's been there for 20 years, when you take all of that metal out, what do you replace it with?
Okay. So there is a protocol that we follow, or I follow. I'm certified through the IAOMT, which is a organization that provide education from the profession and also to the public how to be protected from this toxin. So when you have mercury, the protocol calls for you to be safe, that you don't swallow the mercury, that you don't breathe it, and you are protected, because if I'm working on you, gravity is going to bring everything to your face, to the upper body. So this protocol protects you from the breathing part. So I'm going to walk you through what it is to come and have a mercury removed. Once you get numb, you are covered up, your head is covered up, your face is covered, you have oxygen. There is a type of outsourced sources that vacuum any type of vapor. And I'm going to mention vapor a couple of times because that is the toxic part of the mercury which is being removed. 80% of that vapor, of that, if you were to breathe that, it stays in your lung. And as we know, mercury is very difficult to remove for our system, especially the mercury that goes to our brain. It takes decades to be able to remove that toxic from the system. So when we remove it in our practice, we only use that protocol. If you are a patient that come to me and you decide not to do it, then I won't treat you. Ethically, I cannot do a procedure to you that I know is going to be detrimental to your health. So it is important to be protected. And, those are the three things that you want to look for when you're removing your mercury. You want to have oxygen. You want to make sure that you have outside sources to remove that vapor. And you want to make sure that you are protected. There is something that we call Robitin, which is a sheet that covers the teeth that you're going to be working, so nothing goes down your throat. So those are the three things that are very important to have before the procedure. And of course, there's other things that we have: activated charcoal, some type of pre and post drink. So there's different things, but those three are the most important things that you want to make sure that is part of the procedure, so you don't get exposed to it.
Right. And you and your staff don't get exposed to it as well, because it can be just as detrimental to you if you're not following these procedures. And I think it's really important for the audience to know that not every dentist is trained to do this. And there are some naive dentists out there that think it's not a big deal, and you might ask them to remove them, and that's not okay. They really need to be trained in these methods for sure. Yeah.
Right.
So what do you then do something to the teeth after you've removed these metals? What's the next part of that once they're removed?
Okay, so the next part after removing that is to build the tooth. And at that point, you build the tooth with non-metal material. That could be composite, which is a resin, the white filling, or you can use porcelain, which is like a glass-like material. And that could be a filling, that could be a crown, or what we call our onlay. So depending on what is left on the tooth, what type of structure we're working with left on the tooth, then you build up that area. And in my office, we use resin that is biocompatible. A resin pretty much that is more kind. And everything that we use, unfortunately, have some type of chemical. Otherwise, it's just not going to adhere to the tooth. It's just not, it doesn't stick in a sense. So, but you try to use material that, later on is not going to cause a problem. There are cases that we work with people that are completely sensitive to almost anything. At that point, there are type of testing that we do that will tell us if the material that we're using is compatible. And that test will give you every single type of dental material that are in the market and that can be used. We have people that come with Lyme disease, which, as you know, is very, it's compromised disease that anything can react to it and have a flare. So you have to be cautious and what stage they are as well. So we work with, we partner with other functional medicine, naturopath, to be able to provide the best treatment for the patient. And if after we remove the say removal, we want to make sure that the material that we're placing is going to be compatible. It's not going to cause another problem. So depending, to answer the question, depending on what is it that we're going to do on that tooth, is going to be a filling or it's going to be a crown or an onlay, metal free, of course.
Right. Awesome. Are there ever are there ever times where you don't do fillings because of those sensitivities? Where you just leave it the way it is, or you have to put a filling in, or they'll lose the tooth?
That's a great question. That's going to lead us to something else. So yes, there is time that the tooth is what we call dead.
Right.
And this time, let's say you came to the office and you have a big cavity, you have in pain, and we clean that tooth. And the tooth is actually not completely dead, but it's in a way that is affected. So there are ways that we can put some medication, and there are some holistic or homeopathic remedy that can power up the body, the cells to heal itself. And that would be great. At that point, we can put a temporary material in the mouth, like it's a filling that is temporary just to test the tooth. And we send you home and we give you a week or two. You come back, maybe a month or two. It all depends on what stage we are.
Mm-hmm.
You come back and we test the tooth and the tooth is fine. You're doing good. Well, at that point, we build the tooth like nothing ever happened. But let's say you came back and there's another tooth, and this tooth is a little bit too late now. There's sensitivity, you're having pain. You might have some infection that you don't know. And at that point, then the tooth is treated different. If the nerve is dead, you have to have what is called a root canal. And then, there's this two school of thoughts here. The group of people here that say root canals, we've been doing it for hundreds of years and it's fine. It's a way to save your tooth. And then there's another group of people here that say root canals are the worst thing that you can do in your body. Right. It's almost like you have a car in the middle of the highway, that the highway is jammed, it's backtracked, a couple of miles. You can get to your exit, but what is it going to take? It's going to take hours for you to get there. Well, that's exactly what happened to our body, our healing energy. The healing energy is working so hard to cure this problem, because you have something stopping that energy from flowing in there.
Right.
And you get there, but you get there 3 hours later to get to that exit.
Yeah, because you're trying to avoid the car, right? That's sitting in the middle of the highway, right?
Exactly. So our energy does that. But what happens if you have diabetes? What happens if you have a gut issue that is really debilitating you, and the type of, your vitamins that you can get from your food, right, from the type of nutrients that you can get? What happens if you have acid problem? When are you going to get to that exit?
Right.
It's going to take a lot more effort for you to heal that tooth if you have a root canal and it's infected. So
what you're talking about is body burden. It just adds to the body burden.
Exactly.
Yes. And so, which school of thought are you? Which school of thought are you on? Which side?
I'm glad you asked. So I respect the body in a holistic way, and give the body the power to heal. And I always said to my patient, if you come to my office, just because you're here and I'm a holistic dentist and I don't have a root canal in my mouth, and if I get to get one, I probably won't get it, I respect your opinion. And I always educate my patient to, this is what it is, and this is what I recommend. And you have the power to, with the knowledge that I'm giving you, to decide which way you want to go. I have patients that come to the office and they want to have a root canal regardless to the information that was given, and I'll send it to have the root canal done. I don't do it in my practice just because it's against to what I believe is the best for the body. So with that said, I'm going to go back a little bit and talk about, where are you? There's some people that come to the office and they have root canal that were done 10 years ago, and they have no problem. You take a Xray, a CBCT, which is the 3D image, and you go and you send that to be read. And again, this person come and have the work done, the CBCT done, and they want to know what's happening. And they come back and there's, there might be nothing in there. But if the person has symptoms and you have this report back, almost like 99% of the time it comes back and there's something that have to do with the root canal.
Yes,
And
I
if we
see
go
it all of the time. Just if you could just explain what to the audience what a CBCT is. What does that stand for, those letters?
Absolutely. It's a cone beam. It's pretty much an image. It's a think of an X-ray, but
Mhm.
this X-ray is taken in a 3D in three-dimensional. You can take this image, it's like a photo, but this photo is a 3D. You can rotate it and you can visualize it and study it in a way that is layered. And what do you get with that? You get an amazing type of information. When we take the regular X-ray in our office, it's a 2D, so you can only see front and back in a sense. But when you take a CBCT, a 3D image, you can explore that in a way that you can see exactly where is that infection, what position is that infection, and pretty much how to get to it. And how is that valuable for us? If we're doing an extraction and that infection is on the back part of the tooth, just per se, on that root, you need to get to that in order to clean it. Because if you take that tooth out and you just leave that infection behind, you only solve half of the problem. Half of the problem stay there that later on is going to haunt you, as you probably seen in your patient. So the type of report that we get when we do this type of image is very valuable for people that are looking for answer, especially this type of problem that is originate in your mouth. And you would not resolve these problems unless you address infections and dental issues that have to do, with getting your body in better shape.
Right.
So,
right.
so
Yeah,
going back to the root canal, I want to finish that because
Go
it's
ahead.
important. We talked about the example of issues that burden your health.
Yes.
And when you have a root canal that is infected, and we go back to that car in the highway, that's a root canal sitting in the middle of the highway there.
Right.
And, your body's going to try to heal. But if you have this problem, that car is in the middle of the road, we're going to have the highway is going to be packed for a long time unless that car is moved to the side of taking, out of the highway. So that's how our body works. Unless you remove that toxin, that infection is always going to have a burden. Is always going to have a harder time to heal because there's no way to get rid of that 100%.
So you in that situation, in order to allow the body to heal, would remove the car from the highway, and in the mouth, it's removing the tooth.
The tooth, correct.
Yeah. And what do you put in its place?
So there's different way to replace missing teeth. We have way that we could do implant, zirconia implant, which is the most recommended because of compatibility. Then there's way to replace it with we call a bridge, which is like you use the teeth next to it as a anchor, and then you can replace it. Or you can do something that is removable, which is something like we think about removal, we think about grandpa having the denture in and out or the partial. Right. So there is way to replace missing teeth. And again, we're going to go back to what is the status of the teeth that are next to what we replace. Not everybody can have it. Not everybody can get an implant. So you have to evaluate the whole mouth. How healthy are you? Are you a good candidate to receive the treatment? So looking at the overall picture, it helps you to decide what is the best way to treat Candida. Can she take this? Is she healthy enough to have a good result with this treatment? So there's different options.
Yeah. And, so the big question when when I'm faced with patients who are not like, they get to a point with me and, we review all the things that we've done. And it's just like, what? You got all those root canals, right? I feel like when there's different metals next to each other, is like, that's an absolute, we got to get rid of those. But then when you have people who don't have any pain, their gums look good, because usually signs of gums makes me think, oh, we really have to go there. But if they're not having pain, but they have all this root canals, do we go after that? Because like I've looked at everything else but they might have some sinus congestion. The mouth is right under the sinuses, right? if it's inflamed here, it's going to be inflamed in the sinuses too. Like they're right next to each other. And if they still have depression and anxiety, like the brain is right there, it's directly connected. Yeah, there's like a skull in between, but still things seep right
Yeah.
from
Yeah.
one place to the other. So it's a huge investment to have that done. So I always send people for at least an evaluation. Get an evaluation. Let's just
Right.
do the CT scan, the 3D CT scan, and let's get some information at least, right? I think
Right.
it's important to at least get some information, and then you weigh your options, right?
Right, right.
Yeah.
I like that you said, let's look at, looking at the big picture is so important. We have patients, they come from, after they meeting with you and they said, oh, they sent me here to get some more information. So you collecting the data, what is the best way to help you? There's way to get European scan, which is that tomography. You get the biofeedback. There are other ways for you to see where is that energy holding there? Why is that heat there? And not, we're talking about patients that come and they have no symptoms, but they're sick. They're tired all the time. They have depressions. They forget things, like their mind is, and I get it. We all have a little bit of that. I forgot where I put my keys, but this is more than that. This is people that they are, their brain is fogged. They having more than just little things. And these are the people that you try to collect the information and see what's going on, especially when they come from a visit of, 3, 4, 5 different doctors and different dentists, and nobody figured out what it is.
Right.
And I don't have the answer. I don't. I work with other people to help me figure out what is the best way to help you.
Right.
But that's what you need to figure out. What exactly needs to be done to help this particular patient and figure out what are the problems, and if they all in the mouth.
Right. Yeah. It's always good to get more information. Yeah, I know there's other things that we can do, but I do want to talk a little bit before we move on to other technologies in dentistry, but about the mercury fillings. Let's dive down a little bit more about mercury and how it can affect your health. I know you mentioned some symptoms, but can you talk more about how mercury affects mental health?
Absolutely. So there is a relationship between mercury being a neurotoxin, and I'm going to go back a little bit about the history. So even 2023, we're still having tons of people being treated with mercury, and this mercury is composed up to 50%, 55% of it is mercury. And we know mercury is, if you go to the post office and you have mercury, they automatically, will qualify that as like, oh, you can't transfer that because they have mercury. And if something were to happen with mercury in your office, the Department of Health can come to your office and it is a big deal, but it's okay to put it in your mouth. It just doesn't make sense.
It doesn't make any sense. I know.
So when we talk about this type of, of neurotoxin in your mouth, it's always leaking. Every time you chew, every time you swallow, you promoting, or when it breaks and you swallow it. So now it's a bigger area exposed. So the relationship of mercury in our body, it has this effect in your gut. And when we know that the gut is involved, it affects the whole body. The other relationship, and it's a lot of study, and one of the sites that should be visited for a lot of this study is the IAOMT. This particular is research-based information that can be pretty much read and see how many diseases are associated with mercury toxicity. So depending on what level of mercury is in your system, you can have, we start with depression, which is your home. Like you talk about this and how important it is for the whole system. Alzheimer's, we have Parkinson's disease, chronic fatigue. We have allergies that manifest in ways that, differently. And these, the mercury is so powerful in how it has multiple symptoms and multiple signs in different people that is so complex in the sense, so you might have a different symptom than I am. I see patients that come in for, two fillings, and they are presenting multiple symptoms. We have someone that come with 5, 6 fillings, and they're okay. They just want to get it removed because they have no problem. They're concerned about being proactive.
Yeah.
Later on, they discover that, well, the stomach issues that I had, that pain that I have is related to all this.
Right.
I have a case of this particular young guy. He's in his 32 years old. He comes and he have bald spots.
Mm-hmm.
And he started to track down when did the problem started.
Mm-hmm.
And he have
these are like random bald spots on his head?
Yeah, 2 bald spots.
Okay.
Back in his head. And he came, and I'm like, I know about teeth. I don't know anything about bald spot. But he said, well, I did my research, and I think this is related to the Mercury filling. This is when it was placed. And ever since I have this, and I mean, this is probably like 10 years ago, and he's still in the practice. And that is a joke when he comes always that we mention it.
Yeah. Our patients are so smart. Our patients are so smart. I learned so much from my patients, and yeah, they do all the research, and that's and they hit the books and really figure it out. And it's great that he put it together for you. Yeah,
he did. I'm like, I don't know. I don't know about hair, and it's amazing how they do the research, and thanks God technology help us so much now with we're getting information out. Mm-hmm. More than what we want sometimes, because sometimes it's not true, so we have to be careful. But this guy came to the office, and sure enough, we safely removed his mercury filling, 2 small filling, and this guy symptom is starting to disappear. Within literally 4 months, he saw the result. I mean, you see the effect of mercury in the body, and it's vivid. I mean, this is people that are debilitating. We have cases of Lyme disease. And when I say Lyme disease, you have to be careful because, as you know, these people have to be, in good state to get work done. You just don't come in and you go ahead and working on everybody just like that.
Right. You have to calm down the immune system and really support it first. Yeah.
Absolutely, especially adrenal. You need to make sure that you're in good state. You can literally take, and this is why you want to be careful with people with immunocompromise, because you go and you have a filling removed, non-safe. Now you don't only swallow part of that, you breathe it, and what's going to happen to adrenal is going to shut down.
Right.
Your immune system is going to be completely off. So it's important to understand that mercury is a neurotoxin. Affect severely so many of our system that it is important to understand that.
Yeah.
And I'm gonna tell you something good. The FDA in 2020 finally
finally
yeah, we should say finally, because it's been years that the FDA covered the effect, the heart, the danger of mercury. And finally 2020 came in. September 2020 was an amazing month for dentistry, at least for the holistic part of dentistry, I would say, because they actually say that people, pregnant women, children under 6, any type of immunological, neurological, Parkinson, Alzheimer's, kidney failure, those people cannot have mercury filling because they are high risk. So what happened to you and I?
Right.
Okay. Well, I don't understand
how. In a backhanded way, you're like, you can only have mercury if you're well enough to have mercury. It's like, why it's a shame that they don't take a step further and say that mercury can cause health in it, especially when we have options with the composites, which are safer. They should just outright say mercury is bad, but they don't want to, I guess, take responsibility for everybody they've made sick by not saying it. So it's a little bit of a backhanded win, but but at least finally they're admitting it on some level, right?
That is a big step. I mean, it have to be. One of the things is that if you go to Europe, a lot of the countries in Europe, they don't use mercury. They haven't used mercury for a long time.
Mhm.
Why United States is self-developing in so many areas. We're still behind. Health system, definitely, we need to do better. We definitely have to kind of integrate so many good things that we have, the technology that we have, and all this good stuff that we have nowadays to do better.
Right, we do, yeah. Well, in Europe, they practice the precautionary principle. You know, they take precautions and make sure it's safe before they sanction it being okay. That's kind of going to the wayside now that it's the EU. But I think they're still better than the United States in that they don't just allow chemicals to be poured out from companies all over the place. There's millions of chemicals in our environment now, not just mercury.
Right, right.
But yeah, we're exposed to so many things. But hopefully that's going to change soon. Yeah. So getting back to the technologies, we talked about CBCT. How is that different from a digital X-ray and a digital scan? Can you explain the differences between those things? And I'm assuming those are also different from the classic dental X-rays that people get.
Right. So let's go back one step and talk about X-ray. So the old X-ray that we used to do, it used to be the one that you put in your mouth. You take the photo, you go develop it, and now you have a plaque in your hand that shows. Now we have.
It's fine. Can I just stop you there? You're saying they used to. Maybe you used to do it, but they're still doing it. My dentist still does that.
Okay. Okay. Well, yeah. Sorry. So
it's so funny.
Yeah. And actually, thank you for correcting me. Yes, we are developing countries, so we actually changing things so quickly when it comes to technology. But we go to third world countries to do community service, and this is how it's done. You actually do it, in a back thing, look at Xray, and it's so true.
Right.
So
yeah, we're still doing these
correct.
things though, but yeah, I know. Well, it looks like I am going to need a change in my dentist. That's for sure.
So and I have to say, nothing wrong with that. It's as long as we get the information that we need to treat the patient, it doesn't matter how you get it.
Right.
But the way that it is now mostly done with digital dentistry is that you have the X-ray, you take the X-ray, automatically the image is taken and it goes to your computer and you're able to see this image. With the 3D X-ray is very similar. The image is taken and you see it in the computer. But this image is able to be, and I think I mentioned that a little earlier, that you're able to rotate this image. The amount of information that you get is amazing. I mean, you can look at your sinus. I can tell you if you have, sinus accumulation of fluid in your sinus or layer or some type of changes. I can see the nose in the layers that I can see if you have a deviatum septum. I can see your TMJ and see if you have problem, the clicking and the popping. What is that? So the amount of information is amazing. And the way that we grab the information is to see how can we help you? How can we look at that infected tooth and treat it? That's the difference between the traditional X-ray and the CBCT. Is the 3D is the amount of information that you can extract. And the 2D is limited. It gives you information, and don't get me wrong, we use the 2D every day. But when we treatment plan a case that had to do, well, we're going to replace a tooth with an implant. Well, we want the 3D because it provides predictability, accuracy, and a better treatment. So you use the technology to give you the best of the best. The other thing is that when you take a CBCT, you send that to, if let's say you come to me and you want that CBCT taken because there is a question of an area, let's say, an example, a root canal. We send that information to be more precise to a radiologist for look for any pathology, any abnormality, anything that is outside of what is normal. I get that report back and I get information about everything that I want to know in that image. that information is very powerful because let's say 2023, I'm healthy. My CBCT, my Xray didn't show much information, but let's move forward to 10 years from now, 5 years from now. And now I have a problem. What can I do? You can actually take that CBCT and compare with similar CBCT and kind of get that report. So it's powerful to have that base information.
Right.
That even if nothing came back, at least you have what was normal today. And you can use that information 3, 5, 10 years from now and say, hey, Candida was okay in 2023.
Right.
What's going on now? 2025, 27 or 30, and this is different. How long has that been there?
Right.
So the information is very powerful. It helps to create a predictability, a better treatment. And that is really good when it comes to health, because as you know, dealing with the body can be unpredictable because there's so many issues, factors that can contribute to healing, can contribute to length of time that is going to take that healing. So all that it's information that is powerful.
Right. So it's so when you wrote digital X-ray and digital scan, is that just other names for CBCT, or are they different?
So there are digital scan too that is also done to take impressions. That is scanning, and what that is pretty much you use think of it like a pen, and the pen goes around the mouth and it takes almost like photo. And the photo becomes that image. When you come to the office and we take a GUI impression,
right,
that shows them, it becomes a model of your teeth. Well, you don't have to do that anymore. So what you do is you take this digital impression and that becomes a 3D image, that again, you can also take it and that's sent to the lab to make that crown that you need, or to make that denture that you need, or to make that appliance for your mouth. So dentistry has come a long way.
Wow. Okay.
When it comes to implement the type, and I'm not sure if I'm able to share screen because I'm able to share to show a picture of a 3D image. If you.
Yeah, that would be great. Now, does insurance pay for these 3D images?
The insurance doesn't pay for it.
Does
not.
Okay.
At least for dentistry, unfortunately. And what is usually done is that, when you treatment plan a case, you incorporate it into that treatment. Also, it helps me to help you. And the amount of information can be used for other things. So you incorporate it into the treatment in a way that is affordable for the patient.
Sure. Yeah. Yeah. So were you going to show the image? I wasn't sure if you were saying
Yep, I can do that right now. So this is an example of what a CBCT is, and you can see almost look like a skeleton kind of image.
Yeah.
So I can see every single tooth. I can see the sinus. I can see your nose. I can see your jaw joint.
Yeah.
And this information can be pretty much layered in a way that you can see specific area at any point. And you can magnify that, you can make it smaller, you can make it bigger. So that's what that is in a sense. So this is a 3D image.
Yeah. And what do the red dots mean and the blue dots?
So yes. So the red dot is you making a way to divide that. So in the bottom right here, what you see is those dots. You can pretty much see every single area that you want to explore, that you want to look for pathology, or you want to treat that area for an implant. So depending on what is the treatment, what is the purpose of it, then you can do different or look at a different aspect of it.
Right. And you would be able to see abscesses or infection on this kind of scan. That's great.
Yes. So you're able to see infections, cysts, you're able to see cavities are a little bit difficult to see because the magnification is so large. Right. So you combine this 3D with something similar, like, like the photo of the smile here, that is a panorex. And you can look for cavity in a smaller dimension. So one of the things that is usually, and I'm going to mention this because it's becoming a little bit of controversy as to how we treat infection, especially in the jaw joint.
Mm-hmm.
So one of the things that is it's worth talking about is cavitation,
Mm-hmm.
or infection in the bone.
Right.
So a common thing that is seen if a tooth is infected and it's extracted, this tooth will manifest some type of infection that is encapsulated within the bone.
Mm-hmm.
And what happens is that infection has pretty much live bacteria there.
Mm-hmm.
And as we know, everything is connected.
Right.
So what we usually see sometimes, some people will come and they have some type of pain, some type of ringing, and in the ear, or some type of ringing sensation that they cannot explain. Well, what it comes to figure out with a lot of studies is that when you have cavitation, that would affect different part of your body.
Mm-hmm.
And when these cavitations are removed, sure enough, you find healing.
Mm-hmm.
And the way that this cavitation of this infection within the bone are treated is that the area has to be open again. And think of it like a surgery. You actually go back, almost like if the tooth was there, removing the tooth and go there and clean it out. That's what needed to be done in the first place to avoid this. So it's also common seen in area with the third molars, the wisdom teeth are extracted. And, usually when you see a CBCT, you see that area that is dark and you can see it almost like, it has a well-defined area. Again, these are area that are holding bacteria, that are holding disease in a way, and they have to be cleaned out.
Wow. Wow. No, I'm really glad you mentioned the cavitations because, people, have these since, and I want the audience to know also that you don't have to have symptoms to have these infections and because it's sometimes a very dead area that unless there's inflammation like edema pushing up against, areas where there are nerve endings, you're not going to have symptoms. Some people don't have symptoms, and I think it's important for people to realize that. So it's looking at your history and looking at where am I hitting a plateau in my health journey, and what are the areas that haven't been explored, and understanding that you can have infection anywhere in your body. You don't have to have a symptom directly connected. That like if you have an infection in your gut, you can actually have a steel trap gut and no gut symptoms, but it's showing up as eczema, it's showing up as memory problems or ADD or depression, so it's I think it's just a matter of finding the roots and how understanding that everything is connected.
It is. And I like that you mentioned that, because this is when, sending, a patient that comes to me with tons of cavity, it's like, I know this is not only not brushing, not flossing, this is coming from somewhere else. And that's why working with functional medicine, partnering up with someone to help you figure out how to help these people is so important.
Right.
You mentioned again, depression, you see it all the time.
Right.
These are people that they have multi symptoms, and it's not only the brushing and the flossing. It's like what's going on somewhere else. That gut is so important. It's extremely important.
Yeah, your gut health is really connected to your oral microbiome as well. And so a lot of people have cavities not because they're eating too much sugar, and they like a lot of times they'll say, well, I took sugar out of my diet, I'm not eating that candy and those donuts anymore, why am I still getting cavities? It's like, because it's not the only reason, right? It could be moisture, it could be your microbiome's off, it could be because you have mercury in your mouth.
And one of the things that tend to be overlooked is what kind of medication are you taking?
Right. Yes.
And we know that, whenever you take a medication, it's going to help you somewhere, but it's going to cause, a side effect somewhere else.
Mm-hmm.
And one of the things that I see all the time is the dry mouth. And the effect of the dry mouth is it's so visible and so debilitating because you have people that you're working with. And a few months later, a year later, the work that you did is failing again. But it's because of this problem, it's coming back as a problem. Right. I mean, those are things that are connected so they intertwine that you have to dive in to be able to see where is the problem.
Right. Awesome. So yeah, we really, I think, gone through the whole soup to nuts with everything that you're doing. I'm sure we could talk about this forever. I wanted to ask you questions about toothpaste and toothbrush, but we will do that maybe another time.
Absolutely.
I really appreciate you. I value you and all the work that you're doing, and I'm definitely going to be sending patients to you your way. I'm sorry we had some kind of disconnect for some reason, but now I have another source for someone to do these evaluations with me, because I'm always looking for people to help me with that, especially when it comes to dental stuff. So yeah. And so
thank you so much. Yeah.
I'm glad we did this interview today. Yeah.
Well, thank you for having me. I look forward to continue working with you. I think have someone to partner with and do this multidisciplinary kind of approach to help our patient is so important. Being a solo practitioner, I had to say, it's amazing to have the help of you. I mean, Sally, that you send someone there and they can get help. They come back to you and they say, "Oh, I feel much better now. Yeah, I'm not so tired anymore. I have, my life changed." That's amazing. It's so rewarding. I love what I do, but when you can help someone to live better, it's life changing for them and for you too, because you want to do it again. You want to do it again, and it's powerful. So thank you for partnering up with with helping our community. That's so important.
So this information will be in the show notes, but why don't you just say where you're located, the name of your practice, and where you're located, how people can contact you if they want to make an appointment.
Absolutely. So I am located in the North Providence, in north of the Providence area.
In Rhode Island.
In Rhode Island. We are 2148 Mineral Spring Avenue. And we are general dentists. I'm a general dentist. I've been certified biological dentist for many years now, in Mercury free. And I love what I do. I love to be involved in the community. So visit our website, www.smileri.com, and any question, feel free to drop a question, and I'll be happy to answer it.
Right. And you're on Facebook too.
We are on Facebook as well. So I Study Dental Studio of Rhode Island is the name of our practice.
Right. Yes. Great. So thank you again, and have a great weekend.
Thank you. You too. Thank you for having me.